Okay, Ariane,
Voilà.
so could you tell us more about the mechanisms of these fears?
Alors, je suis très contente que vous me posiez.
Well, thank you for asking me this question. The CPRM resilience tools are built upon the major modes of human functioning, so it is fundamental to understand how they work in adults and in small embryos. If the brain is aware of these erroneous modes of functioning and knows how to hack these fear mechanisms, the resilience tools become even more efficient. The emotional facet of birth might be its most important one because it will have a physiological impact on multiple levels. To get to the essentials right now, we need to understand three core concepts. Firstly, when a patient experiences a stressful situation in the present moment, and stress is at an unprecedented level right now with COVID-19, well, experiencing that stressful situation in the present moment brings to the surface memories of sister situations or engrams. These are emotional scars, unwanted but deeply committed to memory. These memories of events with the same emotional tone are ones that were experienced in the past, either in the patient's own very early childhood, possibly around her own birth, but also possibly during her ancestors' lifetimes. So this phenomenon of memory resurfacing is known as the transparency of the maternal psyche. The resurfacing of these memories creates a wave of unresolved, painful feelings that floods the patient's present moment, thereby increasing the power of her current fear. So now, the patient must face not just the present fear, but on top of that, she must now also face the enormous mass of hidden memory feelings of fear, suffering, and or pain that comes to the surface. That means that her current fear is inflated, it's fiercer and harder to overcome. The problem is that the patient will experience these displaced feelings about past events, which are not hers, as if they were her current feelings about her present events. Here is the mismatch, which creates disproportionate intensities of emotion. This is why it can sometimes look like they are overreacting to a present situation. The transparency of the maternal psyche, the resurfacing of past emotions, is why pregnant women often become hyper emotional, oversensitive, or tearful for no apparent reason. This natural phenomenon is already hard to manage during pregnancy under normal circumstances, but we are far from normal circumstances now. Today's uncertainties about the coronavirus pandemic and the stress caused by scary precaution measures like lockdown, social distancing, and restrictions on whether birth partners can attend some or even all of the birth. This all makes for greater fear and anxiety all around. This destabilization heightens what we refer to as traditional fears. It heightens these traditional fears, the fears pregnant women usually battle with. Then it creates new fears, and it causes more past fears to resurface. This is why the current situation must not be underestimated and calls for proper support to protect mothers going through birth during the pandemic. So now we have seen how we need to protect and support the mother, but we also need to protect the baby from the stress experienced by the mother. We will see how to do this later, but to do that, we will first need to understand the second core concept here, which is that babies in utero, as early as the fetal and even embryonic stages, have inside them two major things to consider. The first force is the child's innate painting. It's innate painting with their true colors, all their capacities, their full potential. We could call this their true inner treasure. This is what parents should focus on. This is their sacred parenting role is to support and assist the child in manifesting their innate painting without distorting and modifying its true colors. So that's the first inner force of the child. But the second force inside the baby can be problematic. The fact that the baby has an unstoppable ability to absorb everything around them like a sponge. This means they will absorb and self-identify with all emotional projections, which can include all negativity, fear, anger, frustrations that are damaging and self-limiting. So if the mother believes, I am rubbish, I can't do this, I can't handle this by myself, I won't survive, I can't manage, I'm not worthy, all of these terrible notions, then the baby will absorb these self-limiting beliefs. These become their perceived realities, their false truths that they will then function with and live by. This is how they create false laws and erroneous survival strategies that will lead them towards an unreleased or unliberated mode of being, mode of operation. This adversely affects their behavior and limits their self-development. So their innate painting, their true treasure and full potential that's waiting to bloom, is then tainted and stunted. But the good news is that we can, and so we must, undo these mishaps. Also, we can and must prevent this from happening in the first place. That's the whole point of this video series, is to give midwives and mothers the tools to protect themselves from today's new fears and to empower themselves with the core belief, I am capable, I can do things, I can do this. These simple but powerful tools are going to allow the mother to protect their babies from negative projections and fears today. So finally, the third core concept we need to recognize is the stress pathology link. As we have said, all our work is based on a very important scientific database through which it is easy to see the multiple impacts of stress on pregnancy and childbirth, but also on the child. That's why we must put in place resilience tools during pregnancy to counter today's new and heightened fears. Applying these tools will help prevent a good number of complications and pathologies. This is my observation in the results so far. Mothers who receive this support report shorter labor with fewer complications. Babies are born notably serene and alert. This is why we are giving you today some powerful tools to use now preventatively to avoid much of this from happening and to minimize the damage. And remember that the good news is that all these mechanisms and all possible emotional damage is reversible. Everything can be healed. I need to stress this point for both midwives and new mothers listening, so you don't see this situation as all doom and gloom. It is not. There is a lot we can do, proactively and reactively. So this is the message to shout out clearly today. Midwives, the impact that your support can have is so important. So understanding these three concepts and transmitting them to your patients is of the greatest importance. In the next videos, we will give you a core set of resilience tools that you can use right away to protect your patients. And remember that birth is also a big initiation. It's an exceptional opportunity to heal unresolved emotions from the past. These are resurfacing all by themselves anyway. So taking advantage of that to identify and heal these old wounds is to empower the mother. The simple tools we will give you next and can lead to the biggest transformations and empowerment.
Les outils qu'on va pouvoir mettre en place qui sont simples, très simples. Mais ces outils vont permettre ça et c'est leur rôle. Voilà.